Okay, I'm Laura Duarte and I'm going to present you the knee. The parts of the knee, the bones, the cartilage, the collateral ligaments, the muscles, the arteries, veins, and nerves. I'm going to start talking about the bone. The knee is composed of three bones, the femur, the patella, and the tibia. This is the fibula, but this is not going to be uh, joint in the joint in the knee. And I'm going to talk about all of the parts of the bones that are here in the knee. I'm going to start with the femur. The femur have the medial condyle that is here, the intercondylar fossa that is here, the lateral condyle, the popliteal groove, and the lateral epicondyle, the adductor tubercle. And this bone is the biggest bone in the human body. We have here the patella. The patella have two parts, the base and the apex. These are so important because here is going to be grouped the ligaments and the tendons. In the base, for example, are going to be grabbed the tendon, the quadriceps tendon. In the apex are going to be fixed, grabs the patellar condyle, patellar ligament. Of the femur is so important, the lateral condyle and the medial condyle, because here we have like a joint by the tibia. The tibia have another parts that are the medial condyle, the medial tubercle, the intercondylar eminence, and the lateral tubercle. The lateral condyle, the tibial tuberosity. This is going to be the inserts of the patellar ligament that is going to be here. And that's it. This here we have the fibula head, but this is not going to be part of the knee. The cartilage. We have three important cartilages in the knee joint. The articular cartilage that is going to be protecting the femur because of the friction is so bad, and we have the we have a lot of friction when we move this joint. So the articular cartilage is going to be there. Then we have the lateral meniscus and the medial meniscus. This is going to be like a pillow, or amortic the jumps. When we jump a lot, this is going to be like a pillow or like a resort. We have here a top view of the lateral meniscus. As we can see, this is going to be more like a circle, and the medial meniscus is going to be more like a C, or like a medium moon. This is a front view of the meniscus. Here we have an injury of the meniscus. This is like a longitudinal tear. This is because we do a lot of activities that create like friction a lot, like something like this, like run all of the days so fast and a lot, like uh, 3 hours a day. This is going to in the pass of the time, we are going to see this longitudinal tear. And this is how the doctor sutures it, like it's only sutures. It's difficult because like near is the bone here, so it's difficult to suture, but it is possible. But sometimes the injury is so bad and we can't suture it, we can't do like therapy, we can't, because the cartilage don't regenerate, the cartilage does not regenerate. We have to replace it with another cartilage, like of the pig or something like that. Or maybe with a bone that is not a bone, like something like metal bone, we are going to replace it. It is difficult. And this is why, this is one of the reason I'm going to talk about it. The second reason, uh, more in the future. This is one of the reasons why the the deportists are so delicate with their parts, or maybe when they feel sick or they have an injury or an impact, um, all of the people run and rescue him because this is his work. And some in the always, or they in the most of the cases, the people can't walk well after this repairing uh, interventions. Now I'm going to go to talk about the ligaments. We have ligaments important here, that is the posterior and anterior cruciate ligaments. The anterior cruciate ligament is here in blue, and it's going to take the bone, the femur, and take him to move to 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 move to the in front of. And the posterior cruciate ligament, that is here in yellow, is going to return it to the initial position. This is the posterior and anterior cruciate ligaments, so important. And then we have the collateral ligaments that are in the like in the border of the knee. We have here the medial collateral ligament, that in the lateral collateral ligament, because you, with your femur and your tibia, you need never is going to move something like this. It is impossible because of these ligaments, and it's so important to stabilize the joint. Then we have here the patellar tendon and the quadriceps tendon. So here is going to be the patellar tendon, and this is the lateral collateral ligament and the medial collateral ligament. They are so important. And we have here the meniscus, the patella, the tibia, the fibula. This is so important. Okay, the fibula is important because here is going to be inserts the lateral collateral ligament. That is so important. Here we have the femur. Okay. The ligaments can't be in injury. How we he, how we injured we ligaments, our ligaments, sorry, by overuse. And how we overuse the ligaments. Okay, it's suddenly contracting the quadriceps. When you contract the quadriceps, and this is so inspired. When we run upstairs is so fast and like suddenly we can, like we bad movement. when we jump, when we change direction suddenly, when we bend in the knee more than 6 degrees, and chronic overuse. The chronic overuse is like do these things, but all of the days. Ligaments are going to be like in progress, so bad, so like in danger. And this is how we can see a ligament or a tendon, or a tendon in injury. And this is how we as a doctor repair it. We need to make like a conduct inside the bone. This is so dangerous. This is so difficult to repair these parts of the body. Why? Because because it's a tendon. The tendon is so resistant, and we can't like take it and only suture it. It is going to be the suture. It's going not the suture is going to break when you move a minimum your tendon. And this is the second cause because of the deportees, because or why the deportees need to be more so carefully with their, or all of we have to be so careful with this joint, because it's so delicate, so because the deportees maybe can't walk like before, so we have to put like something like this to repair it. It's so difficult.